We interrupt this program for breaking news from the Global National Newsroom.
Good morning and thanks for joining us. I'm Donna Friesen. We're here to bring you the latest briefing from Prime Minister Justin Trudeau, who is, as you know, in self-isolation with his family at Rideau Cottage, his home in Ottawa. The Prime Minister has been emerging, I think, every day almost since he went into self-isolation there because his wife, Sophie, of course, had tested positive for COVID-19. He's been emerging every day from his home at Rideau Cottage to speak with reporters, to give a briefing. They gather at a distance. They ask questions from the phone or by phone as well. And shortly after this briefing today, the Prime Minister is going to head to Parliament because this is a big day in Ottawa, an extraordinary day, really, because Parliament will be meeting for a rare emergency session to put in place measures to help Canadians. So in about an hour, a small group of MPs will gather in Ottawa in Parliament. There's an acknowledgement that flying to the capital, not in anyone's best interest, not wise right now. So this small group of MPs will go there largely by car, we're told. I'm not sure how they get from across the country like that. I guess we'll find out. According to House of Commons procedures, there must be a minimum of 20 MPs in the House for business to proceed. Now, the opposition parties have said that they will back plans for an $82 billion direct spending and deferred taxes. That's what Prime Minister Justin Trudeau wants, has promised, to prepare the country for mass illness and to help Canadians cope with lost jobs and wages. Some of that is direct support for families, workers, and businesses impacted by COVID-19. There was a big twist last night, though, when our Ottawa Bureau Chief, Mercedes Stephenson, learned a draft of that bill included giving the Finance Minister some extraordinary new powers to spend, borrow, and tax without actually having to go back to get approval from Parliament, from opposition MPs, until December of 2021. Extraordinary in itself, extraordinary because this is a minority government. Well, that generated all kinds of surprise and pushback. The opposition leader, Andrew Scheer, said he was not prepared to write this government a blank check. So that's where we're at. We understand now. Late last night, the Liberals said they were going to withdraw that draft bill. It was really just for consultation. So it seems that's not going ahead. We're going to talk all about all of that with our correspondents. As we wait for the Prime Minister, though, let's look at the numbers first. There are, we're now at, I think, 84 days. So it was December 31st since the first case of COVID-19 was reported in China. That's 84 days ago. Across the world right now, there are more than 396,000 cases, and there have been more than 17,000 deaths. Let's look here in Canada. There are positive cases of COVID-19 beyond 2,000 now. BC, Alberta, Ontario, and Quebec are hardest hit. They account for more than 90% of all the confirmed cases in Canada, though now every province and territory except Nunavut has detected the virus, and we expect those numbers will rise as they start coming in again today. Mercedes Stephenson is working from home in Ottawa now, and I think you can join me now, Mercedes. Hi there.
Hey, Donna.
So tell us what happened last night, Mercedes, this kind of shock announcement that this draft legislation was going to give these sweeping powers to the Finance Minister.
Yeah, this was supposed to be a really straightforward bill. It had all been negotiated, supposedly, with the opposition. Everyone was ready to vote in favor of $82 billion to help Canadians who've been affected by COVID-19. And then we had a chance to see a copy of the draft legislation, and there was a bombshell in there. And it was that Finance Minister Bill Morneau would be able to do things like raise taxes, borrow money, spend money until December of 2021 without having to get Parliament to sign off on that. So imagine if you could pass budgets without having to go before Parliament, essentially, or even more money than that, billions and billions of dollars worth. And one of the fundamental functions of what MPs do and what Parliament does is to determine how much money the government can spend, particularly when you're in a minority situation, because the government doesn't just have a mandate to go ahead and do whatever it wants. It has to work with opposition parties to get their approval. All the opposition parties were furious about this. I've heard from sources in all of them that they had no idea that this was going to be in the bill, that they'd been in extensive negotiations with the government that they believed were in good faith. So they were really angry about this, not only because they were surprised by it, but because it's really, as you were saying, Donna, unprecedented. And the Parliamentary Budget officer himself said that this was an unprecedented attempt to essentially gain powers that are supposed to be those of Parliament. So this morning, Prime Minister Justin Trudeau, just about an hour ago, tweeted out that that section of the bill has been completely removed. What does remain in the bill still is Section 4. That gives extraordinary powers to cabinet ministers to spend, but only in the context of a public health crisis like the one we're seeing now, not sort of all the way for another 21 months. Andrew Scheer was asked about his reaction to the bill today and why the opposition were so concerned about that. Here's what he had to say just about an hour ago.
We are here today to pass the measures that were announced to help people get through the next few days and weeks. What was not proposed was any kind of unlimited spending power.
So, Donna, you heard him there, and we're just watching emails and watching, if you see me looking off camera there, to see when the Prime Minister is coming up. But certainly something that the opposition was very upset about. And you know, the Liberals are saying we listened, and this was just a draft bill. It's sort of odd that something that dramatic, that unprecedented in Canadian history, would have been in a draft bill that was given to the opposition a day before it was introduced. But nonetheless, you see a minority parliament here at work, and they will not be giving that power to the finance minister, and the Liberals will not be asking for it in the bill.
Mercedes, can I ask you about what we know about how, I mean, we are, first of all, we should acknowledge we're in an absolutely extraordinary times, and that this is not a partisan issue that this country is facing. It's a public health issue. It's a public health crisis and a pandemic. So all politicians seem to be united in understanding that their primary responsibility, of course, is to protect the health and the well-being of Canadians, and they have to develop new ways of operating too. So help us understand how they even pass a bill in Parliament now. Is it true that they only need 20 MPs and that a lot of them will be driving into Ottawa in order to pass this legislation today?
Yeah. So they were talking about there being 32 MPs, so the House is going to look very different today when our viewers take a look at it. It's not going to be full, and that's because we are in this time of a contagion that is extremely dangerous to people's health. So they don't want all of these MPs flying from all over the country into there and exposing themselves and each other to what potentially might be brought in. It's going to be a very small number, an agreed upon number, and that was sort of part of the outrage over this bill, is that they'd agreed upon everything right down to the numbers of people that would be there to ensure the bill passed, really working together, cross-partisan cooperation to try to do what's right for Canadians. No one wants to be seen as partisan politicking right now. People realize this is, in fact, a national crisis, and they don't believe that Canadians would respond to it well. So politicians want to find a way forward together because they believe that's what's in the best interest in the country and that that's what people expect of them right now. So you're going to see a very small number of people in Parliament today. They're going to introduce the bill, they'll debate the bill, there'll be kind of a question and answer period like we usually see with question period, but obviously much smaller, and then that vote. And it's expected that it will receive unanimous consent if the Liberals have taken those controversial parts out that they say they have.
And Mercedes, what everyone watching this, anyone who's lost their job, about to lose their job, is extremely worried about paying the rent, is living paycheck to paycheck. They're looking to political leaders to start delivering fast. Do we have any sense of the speed? I understand that Parliament's operating quickly in extraordinary circumstances, as all the stuff you just explained. When can Canadians expect to actually get some money?
Well, that's a great question. I mean, the rule change will help to speed things up because once they pass that legislation, it changes the rules, and that should come into effect quite quickly. In terms of things like the money flowing to provinces, that money is laid out in the bill, the hundreds of millions of dollars that are going to go to the provinces. But we don't have a sense yet of just how quickly that might flow. One of the other questions is things that aren't even flowing or haven't been approved yet. Questions about things like people being able to receive a direct check with their taxes. that might be a fast way to get money into the hands of people who have lost their jobs and who are really concerned and in a dire financial situation. The other thing that is being discussed and how to sort of speed things up on that and introduce measures to help is small business, because there's a lot being done right now for individuals, which is desperately needed. But at the same time, there's a lot of small businesses, especially in places like Ontario and Quebec, that are being told they have to close because of the emergency measures being brought in, that they are a non-essential service. But they either have to lay their employees off or continue to pay them without an income. So there's sort of a gap there still with industry and with small business that the government will likely have to move and do something about. In the meantime, once they pass this bill, they certainly are aiming to get that money flowing as quickly as possible into the hands of Canadians, to change those EI rules right away so that people don't have to have a doctor's note or are able to apply it much sooner for those benefits.
Yeah, because we know this virus is killing business, and so many Canadians are worried about their family's health and their financial future. So there's so much riding on this. Mercedes, we're going to come back to you as we wait for the Prime Minister. I want to go to Jeff Semple in Toronto now. Jeff, we heard the Prime Minister yesterday giving the sternest warning yet, saying go home and stay home. What have Ontario and Quebec announced? It's pretty radical in those provinces, shutting down non-essential businesses. So only pharmacies, grocery stores, a few other services, I understand, will remain open. How are people preparing for that?
Well, they haven't had a lot of time to prepare, Donna, and that's because there wasn't a lot of warning given. As of midnight local time this evening, all non-essential businesses will be forced to close in the provinces of Ontario and Quebec, as you mentioned, representing more than half the population of Canada, of course. So a lot of people wrapped up in this. In Ontario, the closures will last up to at least 2 weeks. In Quebec, it'll be at least 3 weeks. But in Ontario in particular, Donna, when you look at the list of services and businesses that are being deemed essential and are allowed to continue operating, it is a pretty long list, and not perhaps as frightening as some people might have anticipated. We are, of course, talking about things like grocery stores, gas stations allowed to remain open, pharmacies as well, but also auto repair shops, IT stores like Best Buy, for example, and of course news organizations like ours. So it is a long list, dozens of different categories that fit into it, and so people can log on to globalnews.ca to see the specifics if they're worried that a particular business might be impacted. But in Quebec in particular, the government there facing pressure to take action. That is because we saw a significant spike in cases in the province of Quebec in the last sort of 24 hours when the new numbers came out yesterday. That increased despite the fact that Quebec also lags behind nationally in terms of the number of tests that it's conducting. In fact, the province of Alberta and British Columbia testing almost 3 times as many people per capita compared to the province of Quebec. So it's seeing a spike, but there's also, of course, the concern that it may not even have a clear handle in terms of the number of cases circulating in some of its communities. So closing all these non-essential businesses, of course, is one step, and we're expecting to hear again today from the Premier of Quebec and the government there about possible other measures they might be taking, Donna.
Yeah, and probably safe to assume, I know people didn't have a lot of warning for this in Ontario and Quebec, but really, I think we can probably safely assume this kind of stuff is going to happen right across the country. It's only a matter of time.
Yeah, that's right. And obviously, you know, we're already hearing provinces and premiers in other areas of the country being asked about that. We did hear BC Premier John Horgan yesterday appear to rule out following a similar step in the province of British Columbia, saying that he was reluctant to take that step, that he is asking businesses and others to take precautions, and he doesn't feel like he needs to take that drastic of a measure to enforce it at this point. But of course, this situation remains so fluid, and so too do the government's responses to it. But at least in the case of BC, it appears unlikely that the Premier there is interested in following this step.
You know, one of the tricky things, Jeff, I find as a journalist covering this, and I can only imagine the public trying to decipher the sort of fire hose of information that's coming at us, is all the different messaging from the different premiers, from the public health officers in all the provinces, from the Prime Minister, from the Public Health Officer of Canada. All doing their level best. I'm not disparaging anybody in their efforts, certainly, but the messaging is different depending on where you live. You hear one briefing from Ottawa, you hear another one in BC, and the messaging is different. And I wonder if we're going to get to the point where there will be some unity in the messaging so that Canadians can really understand what is the best, how their lives are going to be affected and what they need to do.
Yeah, and particularly, and we've set up that special email address, yourquestions@globalnews.ca, for people who have questions about COVID-19. We've been trying to put those questions on a daily basis to top medical experts in this country, and a lot of the questions, Donna, especially in the last few days, pertain to just that point, discrepancies that they're hearing between provincial leaders, federal leaders, as it pertains in particular to things like large gatherings. How many people is too many? Can I still hang out with my family? A lot of people in self-isolation, of course. We saw in the last week or so more than 1 million Canadians returning home from abroad following instructions from the federal government to do so. So a lot of people now sitting at home in self-isolation wondering, am I allowed to go out for a walk, for example? And if so, can I go out with my spouse if we were both traveling together and if we're not showing symptoms? And of course, so many of these cases so specific, it's difficult to give a lot of silver bullet type answers to kind of put everyone's minds at ease and clear instructions, and that's complicated even further, as you say, when we're hearing from some provinces and jurisdictions saying, avoid gatherings of 10 people or 50 people. I think it's worth, though, underscoring that social distancing, regardless of whether you've traveled or not, is really the #1 recommendation to keep your distance from people, particularly outside your household. That means, according to the Government of Canada anyway, 2 meters, 6.5 feet between you and other people that you might be dealing with. So if you can go for a walk and keep your distance like that, then a walk is fine. If not, then probably best to avoid it. But as you say, I think that's a challenge for officials in this country, particularly when you see health that is a provincial jurisdiction, of course. Trying to get on the same page and one cohesive message nationally has been a big challenge, and I don't think that they've met that challenge yet.
All right, Jeff Semple, thank you for watching all the numbers and answering all those questions. We'll come back to you as we wait for the Prime Minister. I want to go to Mike Lakatura now, who is in Ottawa. Mike, you have some information about the Senate sitting tomorrow. What can you tell us?
Yeah, don't forget that after this is passed through the House of Commons, it's like any other bill. It's got to go through the Senate. They, too, have agreed to an emergency sitting. We're hearing the quorum in the Senate is 15 senators. All parties have agreed they will reach that number, maybe surpass it by a little bit, but they are trying to coordinate who will come in, who will not. Again, social distancing, just like we were talking about on the House of Commons side. It'll look very different, as Mercedes was saying earlier. Something that maybe viewers don't know about: when we're sitting in the gallery in the House of Commons on Fridays, when it's kind of a reduced staff and when there are not a lot of MPs there, they actually move around to sit behind the person who's asking or answering the question, so it looks like there's a lot more people there. That's not going to happen this time. You're going to see at least 2 desks between everybody. It'll be the same thing in the Senate. We're also hearing that in the Senate they will gather at 10 a.m. to pass this legislation. It doesn't seem like anybody will be holding that up. And again, the parade that normally kicks off a sitting of the Senate or the House of Commons will look very different. A lot of spacing between it. Normally they are just a couple of meters, 1 meter away or even less. Now it'll be at least 2 meters. That 6-foot rule. Also, we are hearing, of course, that there will be 32 MPs will be in the House of Commons side today. Again, they will be spacing out. The Prime Minister is not going to be one of those. Don't forget, he's under doctor's orders to stay in the House or come out to brief journalists. But again, these are all just some of those things that we expect to see, that this is not business as usual, but they're trying to make it in this extraordinary time to make sure that they're doing all of these little things. And it's only after it receives royal assent that the government will start to look at how to get those checks out the door. When we were talking to François-Philippe Champagne on the weekend, the Foreign Affairs Minister, of how to do it, he says we need a system that is quick, that gets the money to Canadians as quickly as possible. It could be possibly through the regional development agencies, something that maybe a lot of Canadians don't know about, but that can get it out at least to businesses. But again, that'll be the focus of today, to make sure how that will happen and how do Canadians get those checks as soon as possible, because they need them now, Donna.
They certainly do, and we have heard from lots of people who we know people who are living paycheck to paycheck, and businesses who are, as I said to Mercedes, this virus is killing business, and there's so many businesses waiting, hanging there, waiting to see what's coming. Mike, when we talk about the Prime Minister living in Rideau Cottage, he emerges for these briefings, and we see him occasionally in still photographs from inside his house. Do we understand how much longer that's going to go on, when he will be able to leave, and also how Sophie Gregoire Trudeau is doing through this?
Yeah, and that's one of the questions that I don't think reporters have asked recently. The Prime Minister yesterday was mentioning about his father-in-law, who's fighting cancer at this time, and how it was his birthday yesterday, sending his greetings there and saying that the whole family, was sending their wishes as well. We haven't heard yet on how Sophie is doing, Ms. Gregoire Trudeau, obviously. But what I understand is that the Prime Minister is set to come out of self-isolation on Friday. Now, will he? Is this, what he should be doing? Should he come to Parliament Hill? Or should he sort of practice what he's been preaching? He's been telling everybody, if you can work from home, then do it. Well, I think the last couple of weeks have shown that he's been okay working from home. We've seen the photos, which sources are telling me are not being taken by his official photographer, but by his kids. And of course, there's been some written about that as well, that his kids, Ella Grace and Xavier, are taking some of the photos of him hard at work, on conference calls with G7 leaders. We've seen that he can do it. He's telling us to do it, and Donna, you're doing it, Mercedes is doing it. I'm one of the few lucky ones who's able to come into the studio and do it, and to actually come to the office. So I think the Prime Minister may have a bit of a decision on his hands here, whether or not he actually wants to go into West Block or into his office just across from Parliament Hill, and whether or not he wants to go in or continue to be an example. Because yesterday, he was pretty clear, go home and stay home. Well, he's home. So is he just going to stay there and work from there? Because at this point, I think he's doing okay.
Well, one of the questions the biggest question we all want to know the answer to, of course, is when this will be over. That has no answer. At this point, it could be weeks, it could be months, most likely months. So I guess as we look to Parliament taking this emergency, holding this emergency session today to pass legislation, let's say this does go on for months and Parliament is unable to meet and life does not return to normal as quickly as we hoped. There must be efforts underway to try to figure out a way to continue to do parliamentary business, but do it in a different way and do it at a physical distance.
Yeah, and Andrew Scheer had mentioned that today when he was speaking with reporters, saying that, look, we are ready at a moment's notice to be recalled to do this again. It seems like this is step one. This is the first time they will be doing it like this. The Conservatives, anyways, seem like they're ready to do this again. You had mentioned before, the difficulty in trying to assemble all of these members of Parliament. We're hearing that the member of the Green Party from Fredericton, New Brunswick, Jenica Atwin, actually drove from Fredericton. So that's not ideal for her, but the Green Party making sure that they have some sort of representation, because their two other members are out on the West Coast, and that would be difficult to get here by plane or otherwise. So I think that the members of Parliament are looking at this right now and saying, let's get past this. I don't think any politician is looking at this beyond weeks right now, even though they're saying it could be months. I think everybody is sort of crossing their fingers at this point and saying, let's get through this now. A source from the government said, yes, this is the first step. This is the first measure we're going to be taking on the economic front. Bill Morneau, the finance minister, has said there are other options that are on the table. And the Prime Minister said yesterday we're already looking at next steps. But I think they're hoping that this will be effective in the weeks to come, and hoping that it's not months. I mean, you had Health Minister Patty Hajdu say, look, everybody, if you don't stay inside, then we're going to have to ask you to stay inside for longer. Just do your part. Let's see if we can really flatten the curve and possibly make this a short amount of period as possible that we all have to do this. So I think politicians are looking at how do we function, in Parliament. Will this have to be the way we go forward? And how many times will we come back to Ottawa? Or is there a different way of doing this?
Yeah, well, there is so much pressure on so many people, including our political leaders, our frontline healthcare workers, and the possibility of the Canadian economy, the world economy, simply tanking. And we're seeing evidence of that now. And so many, people are looking to government and their political leaders to fashion mechanisms that will help people survive and get us through this. You said that Bill Morneau talked about having other mechanisms or other things possibly in his back pocket. Do we know anything more about that?
Yeah, well, I mean, like any government, they say, look, we're going to take one step, see if there's another one that we can take going forward. Will they follow places like Denmark, which is doing the wage supplement or the wage support up to 75%? Canada is not nearly at that level now. It sounds like this government is really trying to sort of take the baby steps forward, not bring everything out on the table just yet. There has been some criticism. You've had people from business councils, Goldie Hyder, who's been saying, look, we need more now. Don't wait. Don't keep some of these measures in your back pocket. Will those calls be increasingly louder? And will this government feel the pressure to do more in the days to come? I think they really want to see how this lands. They want to see how this $82 billion package makes a difference, especially considering that things have been changing so quickly, Donna. As we've been mentioning, a week ago, nobody thought we would be at this point where we had two provinces now, two of the largest provinces, Quebec and Ontario, basically say we're closing all non-essential businesses. Quebec is going to be closed or put on pause, as Premier François Legault said, until Easter. From now until 14 days from now, we'll have Ontario in that type of a situation. I think all of these governments are looking at this right now and looking at the options that they have, and they're changing their game plans day to day. I don't think any government expected this across the world, and I certainly don't think any governments, provincially, territorially, and especially the federal government expected this. I mean, what was it? 2 weeks ago, we were saying that the federal budget would still be happening on Monday the 30th. That clearly isn't happening, and Parliament and, part of parliamentary life is in sort of suspended animation at this point. What will happen, what will go forward? So to your point about whether or not the government has enough measures, what else they have, I think they're asking themselves that very same question. What can we do? Will this $82 billion address a lot of the issues that we have going on right now? Will it help the upwards of 1 million people who are applying for EI? I mean, let's not forget that. This draft, this stimulus package was drafted when we weren't looking at 1 million Canadians applying for EI. It was a lot less than that. So will they have to respond now with something different? Most assuredly they will, but what will it be, and what do they have at their, in their back pockets? You heard Andrew Scheer today say, look, this isn't about politics, and they stopped the talk about, deficits. You had heard 2 weeks ago, there were a number of conservatives who were talking about deficit spending and that this was exactly why the Liberal government had, spent the cupboard dry, and this is what happens when you don't have a rainy day fund. There is no talk of that anymore. You are not hearing from any conservatives. Today, Andrew Scheer was asked a number of occasions by journalists asking about deficits and asking about, is this too much spending? And he said, this is not the time. Canadians need money in their pockets now. This is what we're going to do. We're focused on it. It's a change in tone, and I think, as Mercedes was saying earlier on, it's something that Canadians want to hear. I don't think anybody at home right now who's going through this, who's being told to self-isolate, who is applying for EI, who is trying to just make ends meet, cares about what the federal deficit looks like right now. And so I think governments understand that, political parties understand that, and they're going, let's just try and do what we can now and figure out tomorrow or the next week when we get there.
Yeah. All right. Mike Lecouture, thanks. We're still waiting for the Prime Minister, I should say. We were expecting him about, more than 10 minutes ago, and we're hearing he's going to step out of his house at Rideau Cottage shortly. We're going to go to Jeff Semple in a moment, but I just wanted to bring you up to date on the stock markets. There's been so much hope that these economic stimulus packages, not just in Canada but elsewhere, would do some good. And stock markets in New York and Toronto did jump significantly higher this morning. Let's look at the TSX main index, the Dow Jones Industrial Average in New York, both rose more than 7% within minutes of the start of trading today. So that's more than 700 points and 1,400 points, respectively, for the TSX and the Dow Jones. So there's a surge on the stock markets overnight, some optimism. I think some optimism is what all of us are looking for. Let's go to Jeff Semple again in Toronto. Jeff, one of the, I guess not entirely unexpected bits of news we learned today is that the Olympics are now officially postponed. Canada, of course, had already said we weren't going to send our athletes because it just wasn't responsible to do that in this environment. But this has got to be a blow to all these athletes who, I mean, they are intensively training at this point, were intensively training for what was coming in Tokyo, and now are going to have to put that off till next year.
Yeah, and I think, you know, we've heard a real emotion from a lot of those athletes, you know, and I think it's difficult to sort of define a lot of their feelings at this point, because on one hand, you know, the majority of them we've heard from so far, you know, on one hand devastated, but also, you know, sort of reluctant understanding that this is the situation we find ourselves in, that this was the right move. We saw Team Canada taking the lead by stepping away from the Olympics before the IOC had followed suit and canceled the games. But as you say, we've heard this morning from the government in Japan saying that that is what is expected now, that the games will be postponed for a year. But yeah, for those athletes who have been working and who really now were counting the weeks before they would be heading over to Tokyo, it's devastating news, and many of them are very emotional this morning. But again, also accepting that this is the reality that we're in and that it was the right move, even if it is a difficult one.
Certainly. Yeah, there's no question it's the right move, and a little bit surprising that it took the Olympic Committee so long to make the move. But I guess what they were attempting to do is put in place plans to postpone, not to cancel. They didn't want to cancel. They want to postpone. And that's what I guess the Japanese Prime Minister announced today. Jeff, I know I'm sorry we're waiting for the Prime Minister, and we're going to put you on the spot to go back to some of the questions that you've been answering for Canadians asking questions about health and how they can cope in what we're all enduring. What are some of the most common questions that you're finding Canadians are asking now, especially that we're all told to stay home?
Yeah, we're all told to stay home, and you know, if you're not being told to self-isolate, but just to self-distance. So if you're one of many Canadians who hasn't traveled recently, hasn't had direct contact with someone known to be carrying the virus, then you know that means you're likely still the one, maybe in your family or in your community, who's going to the grocery store to try and pick up produce and food and supplies, of course, these essential goods. And perhaps that's why we're hearing a lot lately, Donna, people asking very specific questions about the virus surviving on foods, produce, for example, in the grocery store. You know, we'd heard a study just the other day published in the New England Medical Journal that found that this virus can, under laboratory conditions, survive on a plastic surface, for example, for up to 2 or 3 days. So, you know, what about a pepper or a cucumber sitting there in the open air in a grocery store? You know, if you take that home and cut it into a salad, should we be concerned about bringing the virus home to ourselves and our families? The answer to that is a bit mixed at this point. There haven't been any known reported cases globally that we've heard of where the virus has been known to have been transmitted through contaminated food. And thus far, we've asked the government for clarification. Their advice when it comes to produce hasn't changed in light of the COVID-19 outbreak. They are just telling people to wash produce, to scrub it well under lukewarm, cold water, and of course to continue as often as possible to wash your hands with soap and water for at least 20 seconds at a time. And that remains to be the best advice. But a lot of people concerned about food, and given that most of us now are staying home perhaps except to go to the grocery store, people are worrying a lot about whether the virus might exist somewhere in that setting. And you know, the advice though from the government remains the same. If you bring food home, especially if it's produce and especially if you plan to eat the skin, just make sure to wash it carefully with lukewarm or cold water, and you should be okay, according to government health officials.
All right, good advice. Jeff Semple in Toronto, thank you. I'm afraid we're still delayed hearing from the Prime Minister. If you're just joining us, that's why we're here. We're waiting to hear Prime Minister Justin Trudeau's daily briefing from Ottawa. It's now been delayed by about 15 minutes. Let's go to Mercedes Stevenson, who is also in Ottawa. She's at home, working from home today. Mercedes, can you bring us up to speed on where we're at with this news that broke last night that the draft legislation that the government was proposing to bring in today and to pass today in this emergency session gave the finance minister some sweeping powers that that a lot of people are seriously uncomfortable about, and the government has since withdrawn it. Walk us through what happened.
Yeah, so Donna, this was a big surprise. No one expected it to be in this package. They thought that it was all hammered out on the opposition side. It was going to be $82 billion, all about getting money to Canadians. Then there was this surprise section about the finance minister being able to raise taxes without having to go before Parliament, to borrow and spend in an unlimited fashion without the approval of Parliament until December of 2021. You can imagine that generated outrage in the opposition, especially when it's a minority government. They don't have a majority mandate to put things through, and even when you do in the parliamentary system, you still have to go before Parliament and get that vote. It's the whole basis of the system why hundreds of years ago they came up with no taxation without representation, that all the elected members would vote to determine what kind of money the Prime Minister and Cabinet would be able to spend. There was a reversal late last night by Pablo Rodriguez. He's the House Leader for the Liberals. He said, we want to work collaboratively to do this for Canadians. We respect the fundamental functions of the House, and indicated there would be a change. And just about, looking at the clock here, an hour and a half ago, the Prime Minister came out and tweeted that Section 2 would be gone. That is the controversial section dealing with the powers for Bill Morneau. Section 4 remains, another interesting one that allows basically unlimited spending by cabinet ministers without parliamentary approval, but only in the name of the public health emergency. So it's much more specific and likely a more limited time. But whether or not the Conservatives and the NDP and the Bloc will be okay with still granting cabinet ministers that kind of unprecedented power is the question.
All right, Mercedes Stephenson, thanks. We're continuing to wait for the Prime Minister. I just wanted to bring you some news about India. That's a country of 1.3 billion people. It is going to go into full lockdown in just 4 hours' time. Talk about not giving people warning. Full lockdown in 4 hours' time. The Prime Minister Modi says that's essential now to stop the slow of the coronavirus. So that kind of serious containment of people's personal freedom is happening right across the world. Let's go back to Mike Couture. Mike, you have some information, I think, about what we might be able to expect from the Prime Minister when we do hear from him, which hopefully will be shortly.
Yeah, and understanding what time it is, I could probably get cut off any moment as he walks down those steps. So I'll try and make this quick. From a source, we're hearing that he will talk about the legislation that will be put on the table. You can expect he'll be asked about why he put in that Section 2, why he removed it, and some of the other sections. Also hearing he will talk about the change in tone, and he will reinforce how he wants people to stay home. Inside the Prime Minister's office, they're really looking to see how that ad campaign lands, the one where he, Dr. Tam, the Chief Medical Officer of Canada, and other celebrities. They've enlisted a number of celebrities, and as the Prime Minister said yesterday, you won't have an excuse to say that you didn't hear the warnings and hear the calls. So, Ryan Reynolds, Seth Rogen, Michael Bublé, a number of celebrities who have put on social media, either Instagram, Facebook, or wherever, saying stay at home. The Prime Minister is going to underscore how important that is, and to talk about that, and to, really try and help Canadians understand that it wasn't just yesterday he was talking about it. It's not just going to be tomorrow either, folks. This is going to be going forward. And I think that's why I mentioned that earlier to you, Donna. He may come out of self-quarantine or self-isolation on Friday, or does he just be the example for Canada and say, I'm going to work at home for the rest of this time because it's working pretty well for me here and it should work for you, and here he is.
All right. Mike Couture, thank you. Let's listen to the Prime Minister.
Bon matin, tout le monde. Good morning, everyone. Let's listen. My apologies for being a little delayed this morning. It was important that I speak with all three opposition leaders because I'm unable to join them this afternoon as the House of Commons reconvenes to pass emergency legislation on COVID-19. This legislation will help ensure that Canadians are getting the support they need during these challenging times. No matter who you are, where you live, or what you do, COVID-19 is having a real impact on your life. Small businesses are temporarily closing up shop. Hotels and restaurants can no longer accept guests. Some people are not getting paid. Others are worried about their job. Whatever your situation may be, our government is here to help. Passing this bill today means getting you the support you deserve as soon as possible. When you're trying to help get money out to people, speed is of the essence, especially in an unprecedented situation like this one. But I want to make it very clear. I believe in our democratic institutions. All of us in Parliament must work together, and Canadians need to see us doing just that. So you have my unwavering commitment. We will protect and uphold our democratic values. We will protect and uphold our democratic institutions as we deliver support to Canadians as quickly as possible. Aujourd'hui, la Chambre des communes sera rappelée pour annoncer...
Today, the House of Commons will be called back to adopt emergency measures announced by our government. This is a very important step to provide Canadians the support that they deserve. I know that people have many questions, and as I've been saying since the beginning, all orders of government are working tirelessly day and night to provide answers. Federal assistance announced last week for workers and businesses is on the way. We're continuing to think of different ways that we can help Canadians. What we've announced up until now is a starting point, but work is ongoing. Ever since the beginning, science and experts have been guiding our approach and our response to this crisis. Scientists and experts have to continue to guide us through what's ahead. As the situation evolves, we're learning what we can do better, and we're adjusting. We will have more information and more support announced for Canadians in the days to come. In the meantime, know that the entire public service is working day and night to support you. I would like to thank all the civil servants, not just federally, but provincially, in the territories and municipally, for all their work.
A lot of Canadians abroad are still having trouble finding a flight to bring them home, so I want to give everyone an update. At least one more flight from Morocco has been scheduled. The first flight from Peru will leave today, and we're working on flights from Panama, Tunisia, Ukraine, in addition to the flights we've already announced from Ecuador, El Salvador, Guatemala, Honduras, and Spain. On that note, I want to thank the flight attendants, pilots, border agents, and airport staff who've all played a crucial role in bringing Canadians home. They've been on the front lines of this crisis for weeks, but they continue to show up to work and bring families together. Just this past week, nearly 1 million Canadians traveled home to Canada. This would not have been possible without the people who work at our airports, at the border, and at our ports. So on behalf of all Canadians, thank you. We see how hard you're working, and we deeply appreciate it. Every day, someone asks me how long these restrictions will be in place, and the truth is, we don't know yet. But here's what we do know. The duration of this crisis will be determined by the choices we make right now, by decisions we take every single day. So if you want things to get back to normal, do your part. Stay home. And if you've just returned from abroad, go straight home from the airport and do not leave for at least 14 days. This is not a suggestion. You cannot pick up groceries or visit your parents or your friends. You need to go home and stay there. If people do not follow these guidelines, we will put much more stringent measures in place. Since the beginning, I have been in constant communication with the First Ministers. We had another call last night, and we agreed that we have to keep collaborating to ensure that all regions have what they need, including testing equipment and medical supplies. We discussed the range of challenges being faced and overcome across the country. We talked about working even more closely together to do more to keep Canadians safe. We also talked about the emergency measures that have been put in place at the provincial and territorial level. The Federal Emergencies Act is a last resort, but as I keep saying, all options are on the table. If people do not comply with expert advice and government guidelines, we will have to take additional steps. Right now, There are people who are still going to work because they have to. Pharmacists, delivery folks, postal workers, custodial staff, truck drivers, and many, many more are keeping the country running. They deserve our thanks for everything they do. But these people are more than just their job. They're somebody's mom or granddad, somebody's best friend or favorite colleague. So please, for them, stay home. And do it for the healthcare workers who we can't afford to lose during the biggest public health crisis our country has ever seen. Because here's the hard truth. If our nurses and doctors have COVID-19, they can't help you. They won't be able to treat you or your loved ones if you get sick. This is serious. The decisions you make have serious consequences, not just on your community, but on the entire country. So do your part. That's how we will keep each other safe. Merci beaucoup tout le monde. Je suis maintenant heureux de prendre vos questions.
Thank you all.
Janet Silver, Global News. Prime Minister, you just talked about the need of getting money out the door as quickly as possible. Critics say this still involves a lot of paperwork. So why not send or give every tax filer a check right now? And to that end, last week alone, we had nearly 1 million people, extra people, filing for unemployment insurance. Processing times can be slow. How quickly can they expect their checks as well?
We recognize the need to help Canadians directly and quickly. People are worried about affording their groceries. They're worried about paying their rent. They're worried about how they're going to stay safe and keep their families safe when they don't have revenue coming in. That's why we've put forward measures that will get money out to them quickly. We recognize that the demand is massive across the country, and we are working very, very hard to be able to flow money to people very rapidly. But as I said, nothing is off the table. We are looking at a broad range of measures for supporting vulnerable people, for supporting businesses, small businesses specifically, and giving more help to Canadians, and we will continue to work and roll out those measures as we move forward.
We recognize that people are concerned. They're concerned as to how they're going to pay for groceries, for their rent, how they're going to be able to care for their families during these difficult times, especially if their revenue is limited or they don't get a paycheck. This is why we have implemented measures so that this money can be sent out to Canadians rapidly, can be sent out to all those in need. We understand that it's a huge challenge for the government to send out this amount of money to so many people, but this has to be done. It has to be done quickly, and the measures that will be passed this afternoon will help us to help Canadians.
CTV National News. We're hearing that some doctors and nurses are waiting more than a week to get test results. That obviously skews numbers as to how big of a problem this is, and more importantly, it limits the ability to trace who an infected person came into contact with. So why didn't your government enhance lab capabilities earlier to prevent backlogs here?
We have been enhancing lab capabilities. We've been increasing testing by tens of thousands of numbers every single day. But we know that there are also backlogs and challenges, particularly in more remote or more overburdened jurisdictions, to get those test results back quickly. We discussed it with the premiers last night, actually, as well. We are moving to accelerate the processes because testing is not just about giving people peace of mind. It's an essential element for the public health response that will keep us all safe. We know that massive testing has been part of the solution in places that have managed to contain or slow the spread of COVID-19. That is why we are investing significantly in increasing both our testing capacity and the speed with which we will be able to respond.
We recognize that there are challenges with regards to test results. We know that specifically in more isolated areas or busier areas, it can take a bit of time to receive results, and we discussed this with the premiers last night. This is why we've implemented concrete measures to speed up the process to obtain results more quickly and for a greater amount of people. Each and every day we test tens of thousands of people more. We have to continue doing more, especially with regards to returning test results. To test someone, it's not enough to have the information to be reassured or that will change our behavior. It's an essential measure to control the transmission of the virus. We saw this in other countries in the world. We will continue to speed up our efforts to have a greater number of tests for everyone as quickly as possible.
Why would your government think it's a good idea to propose a bill to broadly tax and spend without parliamentary approval until December 2021? Many opposition members say they can't support this overreach. Why would you bring politics into a pandemic?
We recognize that this pandemic is moving extremely quickly, and it is an exceptional situation that requires extreme flexibility and rapidity of response by governments to be able to help Canadians and react to a situation that we've seen is moving quickly every single day. So saying, we have a parliament that works, we have an opposition that is doing its job of making sure that we're taking the right steps the right way, and that's why we've been working on drafting the right legislation up until the last minute. We've been in close discussion with the opposition parties to find a way to both get that flexibility to be able to get measures out the door and keep in place our democratic institutions and the values that are so important to us all. We will always ensure that our system works in a robust way, both around accountability and helping Canadians as quickly as is necessary in these exceptional circumstances. And that's exactly what we're going to see this afternoon in what I'm sure will be robust but extremely cooperative and collaborative debate this afternoon in the House.
We recognize that the situation that we find ourselves in is without any precedent. Circumstances are evolving quickly. We need flexible and fluid responses from government. Because of this, we also understand that Parliament and the opposition parties have an essential role to play. We have to ensure oversight. We have to be aware of the measures that are being implemented. We need our democracy to function properly, even in extreme situations. That is why the discussions that we've had with the opposition parties were ongoing up until the last minute. That is why we made certain choices to allow Parliament to resume so that we could have the flexibility that is required. This is a democratic system that works, and we will continue to defend our values and our institutions. Christian Noël, Radio Canada. Is there a use of the telecom company data to do surveillance of those who should be isolated? Are you doing this? And would it be worth violating people's privacy rights in this type of situation? Answer: we realize that we are in a situation where the behaviors and the choices that we need to make as a government will be different than what we would do in a normal situation, normal times. But we are not, to my knowledge, implementing these types of measures. All the options are on the table, as I've already said, but this is not something that we're doing at this point in time, and it's not something that I think that we're contemplating for the days to come.
Recognize that in an emergency situation, we need to take certain steps that wouldn't be taken in non-emergency situations. But as far as I know, that is not a situation we're looking at right now. But as I've said, all options are on the table to do what is necessary to keep Canadians safe in these exceptional times.
Good morning, Prime Minister. Dylan Robertson, Winnipeg Free Press. How many premiers asked you to invoke the Emergencies Act, and what is your tipping point to enact it?
We had a good discussion on the Federal Emergencies Act, recognizing that most provinces and territories, if not all, have brought in their own Emergencies Act to be able to deal with this situation. The Federal Emergencies Act is really a step above that would involve powers of coordination, of rearranging logistical supply chains to cover challenges in various parts of the country. It is not something that the premiers largely thought was necessary at this point. Most of them indicated that if it became necessary, they would of course support it, but they didn't feel it was there yet. I impressed upon them the need to further coordinate and provide data on things like how many ventilators they have so that we can make sure that they are going to the areas, maybe not in their province, but next door, that need them the most and ensure a better level of flow of emergency equipment to the places that need it. But as long as we are doing that in a robust way, there probably isn't yet a need for the Emergencies Act. But as we know, things are changing very, very rapidly. Some premiers were more open to it than others, but all of them indicated an openness to continue the discussions to make sure that we're able as individual jurisdictions, but also as a country, to do everything necessary to keep Canadians safe. Nous avons eu une bonne discussion hier soir avec les premiers.
We had a fulsome discussion last night with the premiers on the Federal Emergencies Act. All the premiers indicated that if we arrived to the point where we needed to invoke the Federal Act, the Federal Emergencies Act, they would, of course, support this. They did not feel that we were at that time yet. We will continue to cooperate and to take the measures necessary to respond to Canadians' needs. And we committed ourselves to working together to have necessary tools to protect Canadians. Thank you. On the line, moderator.
First question is from Teresa Wright from the Canadian Press. Please go ahead. Your line is now open.
Good morning, Prime Minister. I'm wondering if you can tell me if you're worried about signs that the U.S. is keen to move away from COVID restrictions in the name of trying to help jumpstart the economy, and how such a move would impact the Canada-U.S. border agreement.
Obviously, the agreement we have with the United States is limiting all non-essential travel for tourism, for recreational purposes. We recognize the deeply integrated supply chains that go back and forth across the United States, and will continue to ensure that essential supplies of medication, of industrial equipment, of food continue to flow. At the same time, we are continuing in Canada to base our decisions and our recommendations and guidelines to Canadians on science. We recognize that the need for social distancing, which means keeping 2 meters apart and not gathering in groups, is going to be in place for many more weeks. And we will ensure that we are giving the support to Canadians, to small businesses, so that as we get through this, we are able to restore the economic activity that keeps us all prosperous when it is safe to do so. Our priority is keeping Canadians alive and healthy, and that is what we will continue to focus on in Canada.
Merci. Prochaine question.
Thank you. Merci. Next question is from Steve Scheer from Reuters. Please go ahead.
Hello, Prime Minister. Today, the WHO said that the United States could become an epicenter for the coronavirus. You already have border controls in place for non-essential travel, but are you prepared to do more to get tougher on the border? We've heard anecdotally that truckers, for example, are just asked, if they're healthy or not. So is the government prepared to do more on the border, and what could that be?
As I've said, we are braced for a broad range of scenarios. We have put contingency plans for next steps depending on what trajectory the virus takes in Canada or indeed around the world. We are looking at a broad range of things. Nothing is off the table, but we will respond every step of the way with the necessary actions at a given moment. At this time, we feel the measures that we have taken to restrict flow across the border to essential travel and essential goods to goods and essential travel is the important thing that we're doing to keep Canadians safe. Of course, as the situation evolves, we will be ready to shift our posture with that.
Je vous remercie beaucoup. Dernière question.
Thank you. Merci. Next question. Prochaine question. Lina Dib, La Presse canadienne. À vous la parole.
Bonjour, Monsieur Trudeau. Une question très précise.
I have a very specific question. The public service is able to manage all the EI claims. Employers and unions have many questions. So this is the question. Why are you not giving the money directly to businesses so that they can distribute assistance to employees very quickly themselves? We're going to do both things. We will send direct assistance to the workers, those who are eligible for EI or not. And then we will help businesses to keep people on their payroll and not have to lay them off. We understand that in these types of situations, there is no solution that will work for each and every case. We're going to need many different measures, different ways of providing the necessary assistance for families. We will do this in many different ways. It's not one thing or another. All the measures will be taken at once. Thank you. This is all for the press conference. Thank you, everyone.
All right, that is Prime Minister Justin Trudeau giving his daily briefing from his cottage in Ottawa, now returning inside where he is in self-isolation. So broad strokes of what he said is that basically the message reinforced that he gave yesterday. If you want things to get back to normal, do your part and stay home. That's clearly the messaging from this government as we begin to see more and more community spread. I think about half the cases now in Canada are community spread. That means they're not related to travel. That means people are spreading it within the community, and it gets harder and harder to contact trace all of that and find out what's driving the virus and where it's headed. So that's why there's so much more importance to stay home. He also talked about believing in democratic institutions and promised to protect and uphold democratic institutions. That, of course, came after all the criticism yesterday of this draft legislation that included giving sweeping powers to the finance minister and to tax and spend and make decisions without having to go back to Parliament. So making it clear he's withdrawn that part of the legislation that will be introduced today, and says that he will, of course, uphold democratic institutions. Let's go to Jeff Semple in Toronto. Jeff, I think you were able to listen in to the Prime Minister. One of the things he was asked today was about testing. And we know that in some cases there are backlogs in testing, and really nobody can afford to wait at this stage. What do you know about where we stand with tests in this country?
Yeah, Donna, I think I heard the Prime Minister say there that we are increasing testing by tens of thousands of numbers every day. Now, that would be an exaggeration, though Canada has upped its game recently in terms of the number of tests nationally being conducted. We were just looking at some of the numbers, and it appears that Canada is conducting, on average, around 10,000 tests a day. That's a rough average. Yesterday, there were almost 14,000 tests conducted nationally, and that number is on par with what we saw in South Korea, for example, and its mass testing program, which was really internationally applauded as an example of one initiative that helped to get South Korea's outbreak under control, relatively speaking. Of course, South Korea followed up those tests with with quite aggressive contact tracing. So anyone who tested positive, they would track their movements, reportedly in some cases using CCTV and bank records. Nothing like that happening in the context here in Canada. But when we talk about the national testing numbers, Donna, and Prime Minister talked about about collaborating with the provinces to try and increase the amount of tests that can be done, there is a real disparity in terms of provincial numbers, and we're seeing provinces like Ontario and Quebec lagging behind the pack. Alberta really leading the way in terms of the number of tests, and you mentioned backlogs. We've been hearing quite a bit of that from the health officials in British Columbia, talking about the backlog there, that they have just managed to clear that backlog in part by encouraging people not to get tested unless you have severe respiratory symptoms, unless you're an elderly person or a frontline healthcare worker. So encouraging everyone else who feels like they might need to be tested because they have symptoms consistent with the virus, but if they're a younger person or if they're relatively healthy, the symptoms relatively mild, urging those people to stay at home so that in British Columbia's case, they can help catch up with the backlog. But testing is, by all accounts, Donna, a real critical piece in fighting this outbreak, and I think it's one that we're seeing Canada nationally pick up its game, but provincially the breakdown is very different depending on where you live.
Yeah, it sure is. And we know, as you say, that widespread testing is what the WHO recommends. It's critical to reducing the spread of the illness because if you don't know you have it, you could certainly risk spreading it. I know the messaging is to stay home, but I think in parallel, testing absolutely has to start ramping up. And I know that I can't imagine what it's like for doctors and clinicians who test people and then say, go home and sit and wait for your results. It's got to be incredibly difficult for people.
Yeah, and we've heard those wait times, at least anecdotally, and you heard it in one of the questions there, people being told to wait up to a week. Certainly a few days seems to be pretty common. Again, a lot of this anecdotal, but pretty consistent in terms of how long this testing takes, because the test itself is relatively quick. It's a nasal swab. Sounds rather uncomfortable for people who've had it done, but still relatively quick. But then, in some cases, we can see test results turned around in several hours. In other cases, it lasts up to a week. So, of course, that adds to anxiety for a lot of people as well. And I mean, you mentioned the WHO, the World Health Organization, was really, really strong on that message, particularly last week in one of the press conferences where the head of the WHO said that fighting this outbreak without mass testing is like trying to fight a fire while blindfolded. We simply don't know where the problem exists and don't know how, of course, then to try and combat it. So Prime Minister facing questions there about the number of tests, insisting that we are trying to, up our game in that department, as well as in terms of concerns over ventilated shortages, personal protective equipment. Canada, particularly on a lot of those things now, had faced criticism for being a little bit late, perhaps, to increase the amount of supplies that we had. We know here in the province of Ontario, they had stockpiled around 55 million surgical masks after SARS, but it turns out that those have now expired. So, again, a lot of challenges facing this government now and a lot of different angles to this. But I think, again, testing continues to be a big one. And not just the testing as we saw in South Korea, but also then tracing the contacts of someone. So if they do test positive, being able to track down who they've had contact with in the last hours or days to try and make sure that those people are put in self-isolation as well.
Absolutely. That contact tracing is so essential, and those people have to be isolated and tested quickly. And if you can't do that, then community spread begins to just grow exponentially, which is now, I believe the numbers are about half of the cases in Canada are through community spread. Jeff Semple, thanks so much. Let's go to Mike Licatur in Ottawa, who is listening in with the Prime Minister, The Prime Minister did talk a bit about his justification for those sweeping powers that were in the draft legislation that was supposed to be introduced today. Those sweeping powers have since been withdrawn. What did he say about that?
Yeah, it was interesting because he said, look, we respect the institution of Parliament and the democratic institutions and the democratic process, but kind of said, but at the same time, almost as a justification here for it being in there on the first draft, because he was asked pointedly, why was it even in there? And he said, is an exceptional situation that requires a quick response. Almost trying to let himself off the hook, saying, look, everybody, we are in this situation where we don't know where this will go. We don't know how soon we'll need to get money out the door. We don't know what powers we will need. So we wanted to ask for everything out of the gate and then see what we could get. I'm not saying that that's what the thinking was behind what the Prime Minister was saying here, but it sounds a lot like that's where he was going with it, saying that we're in this situation that we've never seen before. So this is why this might have been in there. It's interesting because he didn't seem to need to volunteer that information. He could have kind of given that boilerplate. We respect democratic institutions. We're working with opposition parties to craft it. He did say that up until, the last couple of minutes, we were working with opposition parties. He said he was late for this press conference because he was talking to opposition party leaders. And kind of tried to let himself off the hook there. And he did sort of invoke that as well later on when he was asked about in different jurisdictions whether or not Canada would look at that, using telecom companies to help them trace people who have either tested positive for it or trying to make sure that they see these sort of hot zones or where people are congregating. There was a story today that Toronto may have been using that to try and get information from telecom companies as to where there were clusters of people to try and make sure that they stay home instead. And it's interesting what he said to that. I think in an emergency, we need to take steps that we would not take in a non-emergency situation. So clearly he's saying, look, that's not what we're going to do right now, but kind of opening the door to, if we need to do this, we might have to do this, everybody. And I think the Prime Minister is saying all steps or everything is on the table. I think these are some of the things he means. That if his government needs sweeping power for taxation or that sort of thing. But let's also drill down on that for a second, Donna. Does anybody out there think that the government will raise taxes on people who don't have money in their pocket? I'm not trying to, give the government and this Liberal government a way out here, but I don't think any political mind would look at that and go, that's a good idea at this point. But it is curious to know what they would want to do with that. But saying that everything is on the table, including the Emergencies Act, he mentioned it also, that he talked to the premiers about it. And I wanted to say that something that stood out to me where he said most of the premiers don't think it's necessary just yet. There were some premiers who are more open to it than others, but they think that they're doing a good enough job on their own. But he is open to revisiting that. Clearly, that was in the conversation yesterday, seeing that Ontario and Quebec have taken steps on their own way. And I think what this government is looking at and sort of saying, look, if the provinces make these moves, we'll support them, and we will keep the Emergencies Act as the last resort. He keeps calling it the last resort. And when you think about it, it's a card that they have to wait to play. It cannot be played yet. But, rightly so. A lot of people are asking whether or not we are missing an opportunity to just have a full shutdown and say, this is it. It has to happen now to make sure that we are truly flattening the curve, Donna.
All right, Mike LeCouture, thanks. One of the things that struck me is... Well, I guess what I want to talk about is not so much what's not in this draft bill as what is in it and what Canadians are going to get and what they can look forward to. So sort of setting the politics aside, I guess, in a way. Let's go to Mercedes Stevenson, our Ottawa Bureau Chief. Mercedes, this legislation that we're talking about is to help Canadians and help them urgently. And our expectation is that enough MPs are going to show up in Ottawa today and physically distance themselves, but pass it and unanimously support it. What are you hearing about that? Is that going to happen?
Well, that's a great question because we've had this whole controversy now and we've had the Prime Minister come out and say that they've dropped the offending section of the bill. But I'm looking right now at some tweets by Pierre Poilievre. He is an Ottawa MP who will not be there today because he's awaiting a COVID-19 test himself. He has been at home. He is waiting to see if the symptoms that he has are COVID-19, but he's on Twitter and he says that the Prime Minister has not done enough, that they are still not happy because there is a section of the bill that allows cabinet ministers to take extraordinary powers and to spend under Section 9 of that bill. So he tweeted the following. He says, well, you're at it, get rid of Part 9 when you try to give your cabinet the power to gift our money to any entity you choose, again, without Parliament. These are not loans or share purchases as is normally done, but gifts of cash to entities of your choice. #hell no. So that doesn't sound like they're happy with the current situation. But the issue that they have to deal with here on the opposition side. And I know that I talked to opposition MPs who were mentioning this last night, and I've talked to both independent and conservative senators who've talked about this too. They're stuck because on the one hand, they realize Canadians desperately need the money that is in this bill. They don't want to be the people who are standing in the way of that, and they don't want to look like they're playing politics. But on the other hand, they're still not happy with what's in this bill. Certainly, it's a significant step forward that the Prime Minister has removed that section about Bill Morneau having the tax power, but they're saying there's still extraordinary power being granted to cabinet ministers in other parts of the bill. So, is the bill going to be tabled with that in there? If it is, does that mean that the Liberals are still open to perhaps an amendment? I know, Donna, you and I were talking yesterday about how in the UK there had been a number of amendments to make things more palatable. Could that be the situation here, that the bill's introduced like that with the sort of most irritating part removed from it, the other parts left in that the opposition are saying they won't vote for, but the Liberals will perhaps be open to amendments on that? How will the NDP and the Bloc Québécois react to this? So I think it's not clear cut at this point whether we're going to see the opposition vote in favor of this bill and give the unanimous consent that would be required. It'll be a really interesting day to keep an eye on this and to see how they negotiate it. You know, at the end of the day, I know politicians can drive people around the bend, Donna, and certainly those of us here in Ottawa, but everyone who I've spoken to on both sides of the aisle, or on all sides of the aisle, I should say, has a genuine desire to try to get the money in this bill out to people. No one has a problem with that. So it's sort of this unexpected sticking point that they have to find a way to deal with, or they're all going to look like they're playing politics in the middle of a pandemic.
Yeah, well, I think that is what a lot of Canadians would just find repulsive at this point. Have they only set aside one day for this bill to pass?
They're supposed to be dealing with it today, and that's why the Senate is planning to sit tomorrow. But all of that could be thrown sideways. There's supposed to be sort of 4.5 hours-ish of debate this afternoon. But now the question is, if we start looking at amendments and they're
Oh, apologies. I think we've lost the connection to Mercedes Stevenson. We're all working with, different technology, a lot of people working from home, and apologies, it doesn't always come through smoothly. So, we know all of us only have to look elsewhere around the world to see what could happen with this virus and what has happened. What's unfolding in Italy, for example. Absolutely devastating. Now in Spain as well and elsewhere, it's almost beyond belief, and it is a lesson for other countries, including Canada, to act fast or possibly face deadly consequences. We've been told to keep our distance physically from each other here in Canada, to stay home. That's good advice. If you don't, you risk spreading the virus, making others sick, and overwhelming the hospitals. Healthcare workers across this country are bracing for that. Hospitals are preparing everywhere, including one in Toronto that's doing everything it can. We want to take you inside the Humber River Hospital. It's preparing for war with an invisible enemy.
I can tell you that our hospital and every hospital is doing everything it can to prepare for that surge. It's all hands on deck. Everybody's rolling up their sleeves. My name is Dr. Taslim Nimji, and I'm an ER physician and the Director of Medical Innovation for Humber River Hospital. So when I'm doing my administrative job, I'm helping the hospital in its preparedness for pandemic planning. That's us looking at how do we ensure that we have enough healthcare workers on the job to treat our patients. That's how do we make sure that we have enough equipment. You've heard a lot about ventilators, for example. How do we make sure we have enough beds and space to treat patients? Every patient that walks in is a patient, is a human being on that other side. And we can't forget that in this crisis.
I have a cough, I have a cold.
Okay, you just need to wear the mask and you just need to sanitize your hands.
Ticket R 003. We have processes, triaging processes, where we ask screening questions to try to determine whether somebody is a suspected or a positive case for COVID-19. We are still seeing people that are coming in, anxieties run high, wondering if they have COVID-19, wondering if they meet screening criteria. We are seeing patients that are positive for COVID-19 already, known positive cases. This is a real concern. the amount of personal protective equipment. There isn't a hospital in the province, in the country, that isn't concerned about having enough personal protective equipment to be able to take us through what we're about to experience.
With the 9105 small, okay?
So this means donning, what we call donning personal protective equipment. And this means putting on the appropriate clothing, right? And it's not clothing, it's surgical masks, it's gloves, it's gowns, so that when you're treating that patient, you're then only wearing that equipment to protect yourself, and then doffing, what we call taking off that equipment in a very specific order so that you don't contaminate yourself when you exit that room.
Ticket R 004.
We've talked about flattening the curve and trying to decrease that burden and pressure on the healthcare system. We're still seeing cases increase higher in number daily than we would want. I do think that when you look at other countries comparatively, we may have started pushing the message of social distancing earlier, but there are many of us that are wondering if we need to be more aggressive about that at this point.
Concerns, anything that's related to COVID?
As we're here putting ourselves in harm's way for our patients, which we are happy and proud to do, but as we sit here and come here every day and work tirelessly long hours, and our families help support us to do so, we need the community to do its part. People are going to be hospitalized, and far worse, people are going to die. And we've seen that across the globe. This is not something that's hitting us that we don't know about. We know what the ramifications are here. But if we're not aggressively implementing social distancing measures, then that's going to be a problem. That is going to be a problem for every hospital in the country.
It will be a problem for every hospital in the country. We know that every hospital is preparing for it, and all our healthcare workers are heroes in all of their efforts that they're doing to prepare. We know the latest numbers from Ontario, they just came up, 85 new cases in Ontario today. That brings the total in Canada to 2,176. A lot of people are returning from overseas. In fact, the Prime Minister said in his briefing today that about 1 million Canadians have come home in 1 week. That's an extraordinary number of people. And that at least one more flight is coming from Morocco today. One more flight is being planned to come from Morocco to bring Canadians home from there. A Peru flight, I believe he said, lands today. And they're adding flights from Panama, Tunisia, Ukraine. That's in addition to ones coming from Ecuador, Guatemala, Honduras, and Spain. So a lot of people coming in from abroad. I want to go to Mike LeCouture in Ottawa. I mean, it's fantastic for these Canadians who are desperate to come home, of course. I can't help but worry about what happens when they get here.
Yeah, and the Prime Minister sort of underscored that, didn't he, when he said, look, when you land, go straight home. Don't go to the grocery store. Don't go check in on your friends. Don't go check in on your neighbors. Just go right home. And I think that has been the message from healthcare workers throughout all of this. And he needed to underscore it again, especially when you consider, Donna, all of those countries that you just said that we will have flights coming back from. The Foreign Affairs Minister, François-Philippe Champagne, has been on the phone almost 24/7 trying to get those flights in and out to Canada. And I can just tell you that when we had an interview with him on the West Block this weekend, just before recording, he said, look, I may have to take a call and interrupt this because of what's going on. And he also underscored how difficult it is to arrange all of this. Some of these countries have closed airspaces. Some of these countries have different protocols for when people come in, different foreign nationals come in. Consider this for a second, Donna. If you have a flight crew, a Canadian flight crew that is going into a different country that has a rule that whoever comes in to the country has to be put in self-isolation. Well, Canada has to negotiate with the other border control agency, with the other country, to make sure that the names on that list, the names of those flight crew, are exempt, that they can come in and then either take the flight right out, or that if they do have to stay over, because you can't have flight crews that are working 24/7 at this point, or at any point, frankly, but so that they can stay there for the amount of time that they can to come back. There is a huge logistical machine behind the scenes that has to get all of this done. And to your point about all of these people coming home, one would hope and one would think that they've seen the news that once you get back to Canada, to go home. And if you haven't heard it, the Prime Minister is repeating it on a daily basis and hoping that other health officials are saying it as well. don't do anything on the way back from the airport. Don't tell your taxi driver, your Uber driver, or whoever is driving you back from the airport to take a detour. Go right home, call a neighbor. I mean, I've seen on Facebook and on social media, there are so many people that are offering this help. And if anybody is watching this right now, just take your neighbor up on this. Don't be embarrassed. This is the time. We all have to come together, as the Prime Minister has said, as everybody is saying, do your part, go home and stay home at this point.
So what I wonder, though, yes, that is absolutely the right thing to do and the right advice to give. What I wonder, though, is the health minister has the authority to use the Quarantine Act. Is anyone talking about that, about actually, you know, when the people came from cruise ships, where we know, of course, there were positive cases on the Diamond Princess, for example, people were quarantined. Right. Is anyone talking about doing that with any of the people, for example, from Spain? Spain is now a hotspot of COVID-19.
Well, even, I mean, consider that New York is being declared a hotspot. So if people are coming back from there, do we put them in quarantine? We've seen some people come out of CFB Trenton, that, you know, the army base in Ontario. Imagine how some of the people from the Grand Princess feel. 14 days is almost up, and guess what? You got to go right back into isolation at home. I mean, that's just part of the whole situation. But on the Quarantine Act, as you're saying with the health minister, she has said a number of times, you know, even when you interviewed her yesterday, you know, for our special on Global News, on Global yesterday, talking about what other things do we have that, you know, can be bolstered to make sure that people do this. There are things in the Quarantine Act that the health minister can say, look, people, you need to do this now. And especially when you consider, like you said, people who are coming from these hotspots, it could be that you order everybody to stay home. The problem, I think, that this government is facing right now is that they're trying to do everything with words and urging everybody that they don't want to come in and say, we will have health officials check on you or be stationed outside your door, so that if you, for some reason, don't listen to us and just want to go outside and think, hey, everything's fine because I feel fine, well, then we will do that if we have to. We will order people to do that. But the government doesn't want to get there. And I think when the Prime Minister was talking about the Emergencies Act, speaking with the premiers, it feels like leaders of government across this country are comfortable with where they are now. But again, as we've said, Donna, that's today, that's this hour. Does that mean that after we start hearing from different health agencies throughout the day and seeing the numbers going up, that they will take different measures? That's a possibility. But as you said, the health minister is also sitting back and going, what more can we do with this Quarantine Act? What more can we do with other levers of government and other legislation to make sure that whoever is coming back, you know, the 1 million people that have come back in the last week, you know, are they heeding our warning? Are they listening to us? Unfortunately, you know, we will only have to get to that point when we get to that point, which is, I think, what the Prime Minister has been saying through all of this. He doesn't want to get there. So if you listen, we won't do it. And I think one of the things he said that was interesting to me was, if you want things to get back to normal, do your part, stay home. And I think everybody, in my neighborhood, I can say, Donna, I talked to neighbors. Yesterday was one of the first times that my neighbors rang the door and were on my driveway and said, we're coming to say hi from a distance, but just wanted to check in with you, see how you're doing. And I think everybody is starting to understand and pick up on that. This is different. This is, if we don't want to get to the point where the government comes down and will be going around in police cars, or that you'll have the army going around making sure that people are staying inside. If we don't want to get to that point, we have to take action now. Okay, Mike. Thank you so much for all your insight. I wanted to go over to Mercedes Stephenson and talk again about this MPs are gathering in Parliament now, I understand, to pass this emergency legislation. What are you hearing, Mercedes?
So, Donna, really interesting. They all gathered, and we thought they were going to start introducing and debating. Pablo Rodriguez, who is the House leader for the Liberals in charge of managing all the legislation and relationships in the House, asked for some time to suspend. We don't know if that's because he needs to have further negotiations with the other House leaders, if this is because we're hearing from some Conservatives that they are still not willing to support this legislation, given that not all of the sections granting extraordinary powers to ministers have been removed removed. Just that one big one on Bill Morneau has come out. But they have suspended right now, and it's sounding like we're hearing from sources they could sit until midnight as a result of this. There seems to be a desire to do that by the government, not to sit till midnight if they don't have to, but to sit as late as they need to today to try to get this passed, not to drag this into tomorrow so that it can move on as quickly as possible. But obviously, there's something going on behind the scenes that Mr. Rodriguez needs more time. We don't know, again, if that might be negotiations. But here's an interesting side point for you, Donna, that has just been brought to my attention by my colleague David Aiken, our chief political correspondent. He has discovered, and I'm looking at it right now off camera on my computer, that Scott Reid, a Conservative MP, has posted a blog post saying that he will deny unanimous consent in the House today. He will not vote for this legislation. Can his mind be changed if they change all of the elements of the legislation? We'll have to see, but they do need unanimous consent, and he's saying that he won't grant that. So this is setting up to, again, have transitioned from something that was supposed to be sort of easy peasy, pass it, get it done, to highly controversial, to, okay, maybe now we've got something we can move forward with, and back now to the political drama of not knowing what will happen today and a possible midnight sitting tonight.
And everyone under such pressure, right, to make this happen, knowing that Canadians are waiting for it and needing it, and they can't get the money fast enough. Mercedes Stephenson, thanks so much. We'll catch up with you on Global National, and of course, everything, all the developments will be on globalnews.ca. Thanks so much, Mercedes. Just a quick recap now before we go of Prime Minister Justin Trudeau's briefing today. The government is now working together, he says, to bring financial aid to Canadians as soon as possible. The Prime Minister said this will be done while protecting and upholding democratic values. And the Prime Minister also highlighted, he says, science is guiding government decisions. Of course, he thanked civil servants across the country who, we don't see them, but we know they're working behind the scenes 24 hours a day to launch these support programs to repatriate all these Canadians who are stranded overseas. And although the Prime Minister couldn't say how long this crisis will last, of course, no one knows the answer to that. He did say the duration of the crisis will be determined by the choices that we all make, reminding Canadians again, the best thing you can do is stay home. Thanks for watching, and follow us on globalnews.ca and tonight on Global National. I'm Donna Friesen. Bye-bye for now.
This has been a special report from Global News.
The options to ensure that everyone understands that important public health message properly and continue to stay home, with only a few exceptions, maybe to do a bit of exercise, to walk outside with social distancing, or perhaps to purchase essential goods like groceries.
Merci. Thank you. The next question is from Lauren Garner from Politico. Please go ahead. Votre ligne est ouverte.
Thanks. We're seeing differences in testing and reporting methods and in messaging across the different provinces. Quebec just changed how it reports COVID cases, and Ontario appears to be hesitant to say community spread's a problem there, despite evidence that some infections are a result of that. Are you concerned at the federal level about an apparent disconnect here on how the provinces are handling both messaging and testing? And is there anything that you think can be done about it to address any concerns you might have?
We link with the provinces every single day through our public health laboratory networks, but also through the Special Advisory Committee. We do have a national laboratory testing approach, and we will be updating that and publishing that shortly. One of the more difficult things, I think, for people to sort of maybe understand is that lab testing protocols can change depending on what the epidemiology is in a particular jurisdiction. So, for example, if you are a province that has not seen any community spread, you're getting some individual importations. These provinces are casting their net much wider to see if there's any signs of community transmission. Those who have already detected some of these are busy looking at the connects, the context, and looking at clusters and trying to join up cases with those clusters, which is very intensive work. And the laboratory testing is certainly focused on very specific populations that is very important for the work in containment of any community spread or chains of transmission. So as you've heard, there are some very, very specific circumstances where there has to be priorities, for example, for long-term care facilities, their residents, any kind of outbreak investigation. Hospitalized patients, they must be tested even if they haven't traveled. I've just said now it's about 50% of travelers versus those who are acquiring in the community. That is a very fundamental shift in our epidemiology. So the lab testing protocols will be adjusted based on the experience of the jurisdictions. Having said that, we all would want more tests. This is what we'll be doing, is pulling at all stops, acquire much more capacity in Canada to do more. So I think, I think one has to recognize that there's some flexibility that has to be provided depending on the circumstances, but we all want to up our capacity.
And a follow-up, there's been a suggestion that the use of personal data like cell phone location data could be a way to try and slow the spread of the virus. Do you think that that's a viable effort to undertake to try to contain the public health emergency?
So I think there's lots of innovative approaches, and they should all be examined, obviously with respect, due respect to privacy, ethics, and all of those considerations. But I think that there's been a lot of innovation. I heard in Northwest Territories, they have a smart form which they are providing to anyone entering their jurisdiction, in order to follow them up and ensure that they are in self-isolation, anyone who's coming from outside of the Northwest Territories. So these innovations are actually happening, but with the proper balance of making sure that you're respecting privacy, etc. Having said that, really our primary strategy is to ensure people are self-isolating when they should be, and also that everyone is respecting social distancing. And that in and of itself will cut down on the chains of transmission if everybody respects that. So I can't emphasize how important that is. If we're going to get a handle on community spread, everybody has to respect those measures.
Thank you. Merci. The next question is from Kirsty Kirkup from the Globe and Mail. Please go ahead. Votre ligne est ouverte.
Hi, good afternoon. Thanks for continuing to do these briefings. My first question is to the Deputy Prime Minister, and I'm wondering, is the government prepared to help oil companies and the gas sector, or just workers in the oil and gas sector?
Unfortunately, the Deputy Prime Minister is not on the panel today. It's Teresa Tam, the Chief Public Health Officer, and Dr. New, the Deputy Chief Public Health Officer. So I will pass on your message to her.
I'm sorry, it was still on the media briefing, so my apologies. I am doing the social distancing thing and calling in on the retro telephone here. As a follow-up, I'm wondering, the Health Minister specifically had asked, suggested that some provinces are not sharing all of the data, that this was going to be impressed upon them during the call with the premiers. Can you just give us a sense of, from the perspective of the Public Health Agency, if you will indeed, be looking for specific additional information from the provinces and what you would be specifically asking of them?
Yes, so data is very, very important for a number of reasons in terms of determining what's happening in Canada, exactly where community transmission is occurring, the age groups, and the severity of illness. So those are some of the very key aspects of the data that needs to be shared. I do know that every jurisdiction wants to be able to do that. So my discussion with my counterparts is, do you need some help? Is there a reason why certain things are not being completed as fast as we would all like to see, actually? So it's in some respects, collaboration. It's actually quite complex gathering individual information from the public health side, then your lab results, and then your clinical information. So that is a challenge that we have in every outbreak. But I think everyone is trying to resolve this as fast as possible. And this strong message has been provided by our health minister and with her counterpart, so that we can all work at this together. And of course, the data will drive some of our actions, but also I'm particularly interested in, we've just put together a lot of measures over the last week even. I remember Friday the 13th in particular, because it was Friday the 13th, but you know, we asked to avoid non-essential travel outside of Canada. We put up a travel health notice. Provinces really escalated cancelling of gatherings and really emphasizing social distancing. That's really only happened since then. I want to see through data in an upcoming week or two how much impact those measures have had. And you can't do that without the data.
Escomptés. On ne peut pas y arriver sans avoir de données.
Thank you. We'll go back in the room. On va aller dans la salle
Global News.
What can you tell us about the COVID-19 screening measures by airline and CBSA officials that led them to let through a Markham woman who died a few hours after arriving at Pearson?
Et est ensuite décédée quelques heures après son arrivée à Pearson.
I'm not familiar with the ins and outs, but what I do know is that there's been ongoing and very active communication with the airlines in terms of not letting ill passengers on board planes coming into Canada. And our CBSA partners are really stepping up and making sure that happens. Does that stop some individuals potentially, even at that moment? I don't know the circumstances. What if it isn't COVID-19? Maybe there's some other underlying medical conditions. I can't speak to that case. But I do know that people are very much sort of aware of their role in preventing the impacts on health in Canada. So I have to give a shout out of all the people who are working really hard. Screening this, a lot of travelers is massive amount of work. But also, of course, the numbers of travelers are coming down. We know that as well.
We're already talking. Just a science question.
Bon, une question en matière de
the people under 50 or 65, the people who are not normally dying, are we seeing any patterns of the ones that are hit the hardest? If are they smokers? Do they have respiratory issues? Is there something that's affecting them harder, that's making them get the disease more than the people who are getting the more mild cases?
So with the international data, we do know that age really matters in terms of the severe end of the spectrum, in terms of deaths and severe illness. Definitely underlying medical conditions, so diabetes, hypertension, and other immunosuppressive underlying medical conditions. But what you've asked, the question is actually really important to point out that, in fact, the majority of cases are in the younger age groups. They're just not getting as sick. But can you get really seriously sick? Absolutely. We've all heard of case reports of severe illness and even death, although much rarer, in the younger age group. So that's another reason why I say to younger people, you've heard accounts actually on YouTube and other social media of young people who've had a really tough illness, speaking out and warning others. So we need to spread this message actually to a younger generation so that they don't think it's just an illness that impacts the older age group or the people with chronic underlying illness. All of us can potentially get this disease, and you may not be able to tell whether you're the one that's going to get particularly sick. And so I think that message, I have to admit, hasn't really been out there enough, and that some young people may not be taking this very seriously.
Next question on the phone. Prochaine question au téléphone.
Merci, thank you. The next question is Lena Dibb from the Canadian Press. Please go ahead, your line is now open. Votre ligne est ouverte.
Oui, bonjour. J'aimerais qu'on m'explique, même si vous en avez parlé un peu plus, la transmission communautaire. Sur votre site, vous dites maintenant 48% des transmissions sont communautaires, 42 voyageurs, 7% des contacts qui ont étroits avec des voyageurs. Premièrement, comment vous arrivez à ce chiffre-là? C'est à partir d'un échantillon. On parle de à quel moment est-ce que vous avez vu ces chiffres-là? Et puis, qu'est-ce que ça change pour la suite des choses? Par exemple, pour qui reçoit des tests ou pour notre façon de gérer l'isolement et les distanciations sociales.
C'est Dr. New, c'est quelque chose de vraiment important. On a déjà souligné avec ce qu'on a dit au début de cette séance que les proportions, le pourcentage des cas liés au voyage à l'étranger du Canada, c'est moins qu'avant. Au début de l'éclosion ici, on peut dire au Canada, c'était 90%, puis après 80%. Maintenant, c'est plus ou moins 50-50. Chose aussi à souligner, c'est les cas qu'on voit aujourd'hui, c'est le résultat de l'exposition. Qu'est-ce qui se passait il y a 2-3 semaines peut-être. Donc, pour nous autres, aussi pour les autorités sanitaires à l'échelle provinciale, territoriale, aussi locale, c'est important. C'est quoi les effets des mesures qui sont mis en place maintenant avec la distanciation sociale, parce qu'on va voir c'est quoi les résultats, j'espère positifs, dans 2-3 semaines. Donc, c'est important de tout le monde, les voyageurs qui arrivent et continuent à arriver au Canada, même si c'est beaucoup plus diminué qu'avant, mais aussi pour les personnes qui habitent ici au Canada, parce que oui, on voit maintenant des foyers. Il y a la transmission communautaire à plusieurs endroits au Canada. Et c'est important de vraiment souligner le message que c'est important. C'est la seule chose qu'on peut faire maintenant parce qu'on va gagner le temps pour les chercheurs, les autres, les scientifiques pour développer un vaccin et aussi les autres traitements. Pour le moment, c'est la distanciation sociale. Ça, c'est quelque chose qu'il faut prendre au sérieux par tout le monde et c'est quelque chose à suivre. Pour la transmission communautaire, on sait que les autorités à l'échelle provinciale, locale, ils prennent au sérieux. Ils font des enquêtes vraiment très ciblées pour vraiment briser les chaînes de transmission. Et c'est quelque chose, on sait que tout le monde travaille très fort et il faut continuer tout le monde nos efforts collectifs pour combattre ce virus.
J'aimerais ajouter une certaine partie de cette réponse en anglais parce qu'il y a quelques parties qui sont très importantes. J'aimerais le répéter. Just look at those community-acquired cases. It is important to try and understand what they are. In British Columbia, in particular, we know quite a large proportion of these are related to long-term care facility outbreaks. So they have the initial cluster of community-acquired infection is actually a group of people, and they are seniors, and they're people with underlying medical conditions. So that resulted in quite a high proportion of deaths under those circumstances. There are a number of other long-term care facilities impacted in communities, not only in BC, but also in Quebec and in Ontario. So that is a characteristic right now of Canada's community-acquired cases. What is the answer? Be extremely stringent about how you protect those settings. And do know that my colleagues have put together policy procedures to stop any illness from entering those facilities. That is really important. So, which is why understanding what are those community cases is really important, because your solution is actually quite different. There is a very interesting cluster related to a certain conference, a dental conference, in fact, that yielded at least 20 cases in British Columbia and a recent death. In a relatively young person. This is a working age medical professional going to a conference. There's other cases in other jurisdictions that disseminated from this conference. So you can now describe what that community-based transmission looks like. That's why we need the data. We've now shut down conferences and mass gatherings, and people are reducing any gatherings of over 50, but in fact going even more stringent than that. We're saying stay home and maintaining a 2-meter distance from others. So that response
interdit les plus petits rassemblements dans un deuxième temps et demander aux gens de rester chez eux dans un troisième temps. C'est une façon de réduire
I do think that, as the days go by, as Dr. New and I, provide you with this information, it's important to be able to describe the community transmission in more detail, so that people might not so that we can align the right solution to the actual problem that we're experiencing. Right now, I haven't heard really much in the way of report of transmission between one province to another, apart from if you were at that particular conference, for example. There is one case in the Northwest Territories that had traveled within Canada and not elsewhere. But we will monitor that really, really closely.
This is Dr. New. I just wanted to highlight what Dr. Tam said.
C'est pas nécessaire. Je comprends l'anglais.
Est-ce que tu peux poser ma seconde question?
Ask my follow-up question, if I may.
Des rapports on a reçus à l'agence dans la semaine passée, 90% des cas sont liés à la transmission communautaire.
Of cases are linked to community transmission.
Dans les rapports, excusez-moi, j'aimerais réentendre votre chiffre. Vous dites dans les rapports des derniers jours, 90%. Et si c'est le cas, est-ce que ça ne devrait pas aussi guider d'autres mesures, comme par exemple prendre des tests? Maintenant, c'est des cas communautaires, parce que je comprends les exemples de Dr. Tam, mais j'ai l'impression qu'encore, quand on arrive à 50-50 ou à 90%, on n'est plus dans l'anecdotique de la maison de personnes âgées.
Just an anecdote about long-term care.
Oui, il y a des foyers. Sûrement, il y a des établissements avec des populations vulnérables, comme des établissements de soins à longue durée. Ce que Dr. Tam et moi aussi, on a dit que maintenant, si on regarde les pourcentages en total, c'est vraiment presque 50-50. Mais on a vu une tendance maintenant que même pour la semaine passée, la plupart des cas rapportés à l'agence sont liés à la transmission communautaire. C'est aussi dans des établissements comme Dr. Tam a constaté, mais aussi dans des autres endroits. C'est quelque chose vraiment à suivre pendant les prochaines semaines.
Can I just add that you're talking about percentages? As you shut down travel and travel-related cases, your percentages, of course, going to go up for community
cas d'infection acquise en déplacement va chuter et la proportion de cas d'infection communautaire va augmenter.
Merci. The next question is from Michel Lamarche.
Prochaine question.
Michel Lamarche, TVA News.
Je vous en prie.
Go ahead, your line is open.
Hi, I'll ask the question in English if Mr. New wants to answer in French afterwards. Please feel free. I just want to make sure Quebec yesterday changed the way it's identifying cases. Now we have confirmed cases and suspected cases. Which other provinces does it that way? Are they all doing it that way? I just want to make sure that everything is in line in every province.
I'll answer first in English, and Dr. Tam can add to that, and then maybe si vous voulez, on peut répéter en français.
And if you want, I can repeat it in French.
And certainly, Dr. Tam and I were in close contacts with our counterparts in all the provinces and territories, including Quebec. Our understanding, but we will continue to dialogue with our Quebec counterparts, is that if you recall, way back in the beginning in Canada, to really get what we call a laboratory confirmed test, the provinces agreed that all of their samples would be sent to the National Microbiology Laboratory for that final confirmation. As time went on, and certain provincial laboratories, so this is at the main laboratory at the provincial level, got more experience, and they were using a different methodology. Once everyone was comfortable from a quality assurance point of view that they had what we call a validated assay, then it was no longer necessary to send the samples to Winnipeg, to our national laboratory, for that final lab confirmation. So that was first British Columbia and Ontario, Alberta, and so on, and Quebec as well. What's happening now, we understand Quebec, and I think it's probably part of it is to be open and communicate as quickly as possible. Their laboratory results were also being confirmed at the provincial laboratory level. But what I understand is being reported now in Quebec is also test results which are being done in community and other health settings, and not already or necessarily being confirmed at the provincial laboratory level. So obviously, I think in terms of quality assurance, Quebec is looking to make sure, obviously, that the reported cases, laboratory confirmed, will truly all be of sufficient quality that may be the way forward. But at the present time, that's what we understand. And certainly, I think quality assurance in terms of lab testing is something that all provinces take seriously. And at least for myself personally, I think Quebec is maybe the first to go forward with that type of reporting of laboratory results outside of sort of the provincial level.
En dehors des laboratoires provinciaux.
Anything to add to that? No.
We actually have been counting what are called presumptive cases in other jurisdictions as well.
Enfin, les autres provinces comptent
we have
également
included
les cas
those in
présumés,
our case count.
et nous les comptons au niveau national également.
But is it the same way that Quebec is now doing it? Seems unclear from the answer that I received.
Ce n'est toujours pas clair dans mon esprit.
We'll continue to talk to Quebec and with our counterparts in the provinces' territories at the present time, based on what we hear Quebec is doing. They're, I should say, also reporting cases from other settings rather than sort of just the official confirmation from the provincial laboratory level. So that's something we'll discuss and also see how the other provinces are doing. At the present time, certainly our understanding is that from the other provinces, they're being reported once there's confirmation at the provincial laboratory level.
Thank you. Merci. The next question is from Brian Platt from the National Post. Please go ahead. Votre ligne est ouverte.
Je vous en prie.
Hi, I had a question about technology and testing. Last week, Health Canada said it had approved 2 more diagnostic test kits, and it looked, from when I just Googled it now, that those are test kits that could speed up testing a lot, do it in a couple of hours instead of a couple of days. Do you have an update on where things are at with new types of testing and how soon we may see it rolled out in the country?
Dans quelles mesures seront-ils démocratisés dans l'ensemble du Canada?
So I think to enhance laboratory testing capacity in Canada, we have to pursue many different streams. So increasing capacity at the provincial labs and increasing the speed at which they can diagnose is important. But there are particularly attractive options, for example, in more remote communities in our territories, where some of these technologies going to be very helpful because some of the difficulties in turnaround time is that you have to fly samples through, and even if the lab, that referral lab, can turn it around really quickly, there's transportation times, etc. So we're absolutely actively pursuing those, and our National Microbiology Lab has acquired some of these rapid test modalities right now, and they are quality assuring them to make sure that they can actually diagnose. And then that will be very soon that we will be able to, if they work, be able to then roll it out. I would see those kind of technologies particularly important, as I said, for communities that have difficulties reaching some of the major testing centers.
Can you just expand on that part about transportation? I don't think I fully understand. So it's a matter of getting samples to the national lab? Is that what you mean by that?
Yes, or the nearest referral lab, but for sure the National Microbiology Lab is still doing the samples for the territories and some of the smaller provinces in Northern Ontario. You can imagine if they have a kit that they can use more near to the patient or the hospital or the clinic, that would save a lot of time in terms of a turnaround. So those are the solutions that we're right now testing.
We'll have time for one last question. Dernière question.
Thank you. Merci. The question is from Annie Bergeron.
Annie Bergeron, Olivier,
de CTV National News.
Votre ligne est ouverte.
Hi, thank you so much for doing this. My question is for Dr. Tam. We're hearing of major delays in testing, sometimes 8, 9, 10 days in the city of Ottawa. I'm wondering if the delay in testing results is also leading to a delay in contact tracing. And is there any concern that these backlogs could result in more community transmission as people see delays finding out whether they've been exposed to a confirmed case?
Well, I think sort of speeding up lab tests is very, very important as you're trying to detect cases and contain them. But right now, there is an issue with getting lab tests to everywhere at full speed. But at the same time, I can say that the public health measures are being implemented. So public health doesn't necessarily wait for a lab test if they think that, around the cases, the contacts will already be traced. They will be asked to self-isolate, and they will manage them as actual contacts. And on top of that, we now are asking everyone to social distance and self-isolate if you've been instructed by local public health. That is to say that we are doing the public health measures even if the lab results are not available very fast. So that's a preemptive approach to public health, which we normally do anyways. So, I think if lab testing isn't available just at that moment in time, they're going to manage people like their cases. The threshold for managing people like cases is extremely low. Any symptom, any risk, you're going to be managed like a case.
Okay, and my follow-up for you is that we're aware of doctors and nurses who have now been waiting anywhere from 7 to 11 days after being exposed to a confirmed case. I'm wondering, when you talk about healthcare workers being prioritized, is that in terms of testing or in terms of laboratory results? And how does a frontline worker who's waiting 8 or 9 days to get a confirmation get back to work? Is there going to be a delay as well in getting those 2 negative tests to return to the hospital?
So there's a lot of different pieces and concepts in there. So symptomatic healthcare workers are an absolute priority to test. So we're not testing asymptomatic people. We're testing symptomatic healthcare workers, and they are absolutely a priority group. So anything that can be done to speed up those results are important. In the meantime, though, the issue is that they'll be taken out of work. And so that is an issue in terms of course, healthcare system capacity. But they'll be managed, of course, as though they are cases until their lab results are available. But that's how healthcare workers are being managed. And as I say, We're doing everything that we can with domestic solutions, trying to pull up all stops and ratcheting up that laboratory capacity as we speak.
Et au niveau des tests de laboratoire.
Thank you. That'll be all for today. Thank you. Merci beaucoup.
Thank you. That's all for today.
Thank you. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne et merci de votre participation.